Hello, fellow YouTubers. I'm Dr. YouTube. I upload regular medical educational videos. In today's episode, I will talk about the difference between um, inflammatory arthritis, in particular rheumatoid arthritis, and osteoarthritis. um, I'll talk about the pathology, the radiological findings, and the physical findings. So let's start with the more common osteoarthritis. Osteoarthritis is a type of non-inflammatory arthritis. It is what we know as wear and tear of the cartilage. Symptoms are usually worse at night or after exercise. And as you can imagine, as one ages, or if there's any cartilage abnormalities, you have cartilage wearing out, and eventually you have bone hitting onto bone, rubbing against one another. What can happen on an x-ray is you also have fluid going in, so you can have subchondral cysts. Chondral is cartilage, so when you have bone wearing on bone, sometimes this synovial fluid can get in and can have a form subchondral cyst, so below cartilage cyst. So that is non-inflammatory arthritis. It tends to be worse after activity. Compared to inflammatory arthritis, there is minimal joint stiffness, and that's a key point. Less than 30 minutes. You can have joint swelling. But the key thing there is joint stiffness is not a prominent feature. And if so, it lasts less than 30 minutes. The treatment of osteoarthritis is basically painkillers such as non-steroidal inflammatories and also steroid injections. On an x-ray, aside from the subchondral cyst that we mentioned, you can also have osteophytes, which is basically hypertrophy areas of bone. For example, if it's in the DIP of the hands, it is called Heberden's nodes, and if it's in the PIP of the hand, it's called Bouchard's nodes. And also, it can affect any other joints, such as the cervical vertebra, and that is called cervical spondylosis. So, key point, osteoarthritis is a non-inflammatory cause of arthritis, and it's basically bone wearing on bone. You can have osteophyte formation, and can cause things like Heberden and Bouchard's nodes. You can have subchondral cyst formation, and the key feature is there is minimal joint stiffness, less than 30 minutes. Now let's look at rheumatoid arthritis, which is the inflammatory arthritis. Whereas osteoarthritis is localized to the joint itself, rheumatoid arthritis is a multi-systemic disease. It can affect extra-articular areas. And why is that? The reason is because it is an inflammatory arthritis where you have rheumatoid factor, IgM. And this basically attacks body cells containing IgG. So you have the body, rheumatoid factor, IgM, fighting off its own cells, the IgG. That's a type 3 hypersensitivity reaction. Prominent feature here is joint stiffness, lasting more than an hour. And the key genetic here is HLA-DR4. Tends to affect the joints peripherally and symmetrically. And as I said before, you can have extra-articular findings. So the key points, for example, in the lungs, it can cause rheumatoid nodules. In blood vessels, vasculitis, it can cause dry eyes, pericarditis, anemia, leukopenia, and it can affect, as I said, tends to affect the peripheral joints symmetrically. Okay, symmetrically. The pathophysiology is that you have, this is the key word here, pannus formation. Basically, it's basically a collection of T cells and macrophage that destroy the cartilage and invade other structures. So the T cells and macrophage from the granulation tissue destroys other structures by activating osteoclast, activating collagenase, therefore destroys the cartilage. So it's bad. It's much more destructive compared to the non-inflammatory osteoarthritis. If you can imagine, you have cartilage between C1 and C2. It's a transverse ligament. So this is C1. C1 is the atlas, also known as the atlas. The axis is also known as C2. The dens belong to the axis. And you have the head, which sits around here, rotates around it. If you can imagine, this is your spinal cord sitting here. This is your transverse ligament. So with inflammatory arthritis, you have pannus formation, macrophage, destroying, if you just imagine, activating the macrophage, activating the collagenase, destroying the transverse ligament. What will this happen? This will obviously break down. And what will happen to this? Well, you have impingement of the spinal cord, and that is bad. You can have quadriplegia. Yeah, so that's bad. So how can you diagnose it? Well, as I said before, you can have rheumatoid factor, which is IgM positive, but it can be also positive in other conditions, such as tuberculosis. More commonly tested is the anti-CCP and the anti-nuclear antibody. Some typical findings that you find in rheumatoid arthritis is you have Bretonnier's deformity of the thumb. Okay, you can have Swan neck deformity and ulnar deviation of the metacarpophalangeal joints. Swan neck deformity is basically where you have flexion of the DIP, hyperextension of the DIP. So swan neck, ulnar deviation, Bretonnier's deformity. Those are the three key findings that you'll observe in late stage rheumatoid arthritis. Okay, so I think we've gone through the main key points. Let's just quickly try and summarize. Rheumatoid arthritis, you have a systemic inflammatory response, affects mainly the symmetrically synovial joints, so containing cartilage, and also key feature is you have joint stiffness more than an hour. Pathophysiology is pannus formation with destruction of the cartilage. Complication could be extra-articular, including the lungs and the blood vessels, as well as the transverse ligament of the C1 and C2, resulting in quadriplegia, if not carefully managed. Rheumatoid factor frequently present, and the management is similar to non-inflammatory arthritis, painkillers, but in addition to that you have disease-modifying agents such as methotrexate and leflunomide trying to alter the disease activity of the macrophage. You have pannus formation, and radiologically you have bony erosions. So you'll see this cartilage being eaten away, very atypically, on an X-ray. You can have undefined clinical findings, Swan-like deformity, ulnar deviation, Petonius, deformity of the thumb. Compared to osteoarthritis, osteoarthritis is a non-inflammatory condition. You have basically wear and tear of the cartilage. On X-ray, you can have subchondral cyst. Joint stiffness is less than 30 minutes. It's not a predominant feature, and tends to be worse as the day goes on, with more activity, obviously. The management is not DMARDs, but simple analgesia, painkillers if required. I hope you found this video helpful. If you do, please give it a thumbs up, like and subscribe. Look after your joints and take care.